dear Harry, and my dear old friend and new friends in Gaston. I'm Dr. Shu Ti. It's a pity that I cannot be there with you this year because as this year's theme, I am practicing electing health. I myself is a candidate for county government's governor this year, so I'm currently running the election campaign. The voting date is on November 29. I hope you all pray for me to win this campaign and become the governor. Okay, today my talk is about effective national leadership for improving health and reducing inequalities. I will first talk about what is public health leadership, and then using Taiwan's age-friendly city initiative as an example, and to give you some of my reflections. First, what is public health leadership? According to WHO's definition, leadership and governance in building a health system involve ensuring that strategic policy frameworks exist and are combined with effective oversight, coalition building, regulation, attention to system design, and accountability. And according to a UN publication, good governance is perhaps the single most important factor in eradicating poverty and promoting development. And there are several common elements in governance. First, policy guidance, which means defining sector goals, directions, and spending priorities across services. Second, system design. Third, regulation. Fourth, collaboration and coalition building. Fifth, intelligence and oversight. This is very important, and we have to ensure generation, analysis, and use of intelligence on trends and differentials in inputs, service access, coverage, and safety. And also, in governance, I think you know that accountability is a very critical element. Accountability means delegation or an understanding of how services are supplied, plus financing to ensure that adequate resources are available to deliver essential services, plus performance around the actual supply of services, and receipt of relevant information to evaluate or monitor performance, and enforcement such as imposition of sanctions or the provision of rewards for performance. And according to my definition, leadership is the power and the process of effectively influencing others to see, to think, and to work together to achieve successful positive change. And a leader is defined by its followers. No followers, no leader. High-performing followers is the symbol of effective leadership, and the best leader of all is the leader of leaders. And later, I'm going to show you how does the Health Promotion Administration serve as the leader of leaders. And the leadership in public health is influencing the whole government and the whole society to achieve equitable and sustainable population health gain. It takes evidence at one hand and the courage to defend human rights at the other hand. And as we have said in the opening, quite often we found that the hand holding the power to defend human rights is often weaker, too weak, so we must strengthen it. Okay, now Taiwan's age-friendly city initiative as an example. Let me show you, this is the figure illustrating how do we lead the change process. First, define the problem. Second, offer policy guidance and system design. Third, financial support and empowerment. These two must be done together. And then collaboration and coalition building, and then oversight and accountability. And the roles of health promotion leaders, I think we can at least include 3 roles here. First, to serve as an advocate. Second, to serve as an enabler. And third, to serve as a mediator. To serve as an advocator, we try to speak up. Here is a problem, and we can make a difference. And then we seek political support at both national and local levels. And we reframe the issue, and we try to remove the stigma, especially for the issue of aging. This is very important. And to serve as an enabler, we launched the pilot project and to learn experiences from the pilot project. And then we developed our module and tools for implementation and evaluation. And then we offer seed budget for local governments and, to give the budget together with accountability. And of course, we offer capacity building, and then we also did oversight, benchmarking, and experience sharing. And to serve as a mediator, we offer information regarding other sectors, policies, and activities. We also offer a list of consultants and resources. And also we try to build up international relationships. So first, according to the loop of leading the change, the first thing is to define the problem. And as I said, we have to speak up. Here is a problem. I will not go into the details, but in Taiwan, actually, in 2012, our proportion of working population actually has started to decline. So it's a very critical period. And since 2011, we have spoken up the voice that the aging tsunami has arrived, okay? And we also tell people that women lived longer, but they were not healthier. They spent a longer time on unhealthy status. And this can be changed. Actually, higher expenditure and expectancy, we was have. For people who lived shorter, actually, they spent more and they were not healthy and they lived shorter. But for people who are healthy, actually, they have better functional status and they have better survival, but they spent less. So this is very important to let people know that prolonging people's lives doesn't mean to add burden to the society. Rather, it's creating resources and it's reducing the burden. Okay, and in the year 2011, we sent a very strong voice that aging tsunami has arrived, and such a press release appeared at most of the newspapers' headline on their front pages. And we also say that the speed of aging in Taiwan is too fast, and we must prepare ourselves as soon as possible. And we can have positive way to look at aging. So we have these press conferences, these pictures, these symbols to let people know that actually aging people, they can be very healthy and very strong, even healthier and stronger than us, okay? And then we provide policy guidance and system design. In Taiwan, we have the population policy guidelines and population policy white paper, which includes 3 parts. First, low birth rate. Second, about aging. And third, about immigration. And in the part of aging, there are 5 strategies regarding how to work with our population aging issue. So first, strengthening family and community care and health system. Second, ensuring financial security for older persons and promoting reuse of human resources. Third, providing age-friendly transportation, public places, and housing. Fourth, promoting social participation and leisure time activities. And fifth, perfecting the lifelong learning system. So at the country level, we have such intersectoral policies and actions. And we have the National Plan on Age-Friendly Services. We have the National Plan on Healthy Aging. And we also have different plans from other ministries. And then we adopted the WHO's module and WHO's guidelines, so including active aging policy framework published by WHO, and global age-friendly city, a guide published by WHO too. And according to WHO's definition, age-friendly cities are an inclusive and accessible urban environment that promotes active aging. Okay, and also in WHO's module, they have this working schedule for cities to work on board. The first 2 years are for planning activities, and followed by implementation, the year 3 to year 5, and then evaluation process, and then continuous improvement. Okay, and we also offer some, more detailed, explicit working procedures for our cities and counties. So this is the process of promoting age-friendly city. First, to establish age-friendly city multi-sectoral committees, announce routine meeting with mayors or magistrates as the convener, and then organize the cities or county-based counseling team and build partnership with other sectors, including private sectors and NGOs, and then perform the needs assessment, and then implementation, etc., and then apply for WHO's membership, etc. Okay, and our pilot project was launched in Chiayi City, and actually not only the mayor but also our president were there to kick off the pilot project. Okay, and they all pledged towards an age-friendly society, and this is the wish signed by the president. Okay, and at the baseline, at the country level, we also did our national survey to see among 8 aspects, which aspects were the weakest in Taiwan, and we found that civic participation and employment, communication and information, and transportation are the 3 aspects people have poorest satisfaction. And the Pilot City project was launched in 2010. In 2011, we already had 8 counties or cities on board, and then in 2013, we have all the counties and cities on board to promote age-friendly cities or counties. Okay, and we have the very special financial source from our tobacco surcharge revenue. So we use the tobacco surcharge revenue for health promotion, and we also spent, just a small proportion of it on this age-friendly city project. So actually, each city or county may get 30,000 USD, about 30,000 USD per year to serve as their seed budget. But of course, we encourage the local governments to also allocate budget to make the project bigger. Okay, and we have workshop and training courses. And to apply for a budget, the mayors or the mayors have to sign the letter of intent to launch the initiative. This is to engage the mayors on board, and they have to set up a structure of cross-sectional committees, including, for example, people in charge of friendly physical environment group, social welfare and health service group, planning and coordination group, and marketing and promotion group, for example. Okay, and then at the local level, they also have their own training activities, and they have to cooperate with NGOs and academic institutions, and they have to do the needs assessment, including the self-assessment on the city or county systems and health statistics, health status, etc., and also questionnaire survey to see people's awareness and expectations, and also we encourage them to did a lot of community-focused groups and forums to have people to have face-to-face discussion about their wishes. Okay, and then according to their assessment, they identified the city's problem on 8 domains of age-friendly cities, and then they can set their priorities and develop their action plan. Okay, for example, on housing, on communication and information. I will not go into the details, just to show you that they can apply the results of the self-assessment to develop their action plan and have their innovations and improvements, okay? This is age-friendly transportation with the low floor bus and etc. Okay, the transportation system, the traffic light system, okay, and outdoor spaces and building, and to encourage civic participation and employment, community support and health services. There are a lot to do. Okay, these are the community health promotion activities, intergenerational activities, and to encourage social participation in many, many different things, okay? In leisure time activities, in lifetime learning, and of course also in employment and senior voluntary services, okay? And each year we held the National Fun Contest for older people. For those who stayed at home, we try to engage them outside. For these fun contests, they can practice for the whole year, and they joined the contest every year. Okay, currently we have actually more than 80,000 people, older persons, joining this contest, and it accounted for more than 3% of our total adult population. So very wide population rate, and of course we also advocate for respect and social inclusion. Okay, and we also encourage for evergreen economy, silver economy, age-friendly shops, age-friendly pharmacy, age-friendly facilities, age-friendly tourist sites, evergreen tourism, etc. Age-friendly tourism, and new business on financial planning, and also the other very interesting is some groups to serve for matching your girlfriend. Okay. And so we actually try to have a few categories, such as age-friendly restaurants, age-friendly banks, age-friendly stores, age-friendly hotels, age-friendly travels, etc. And regarding oversight and accountability, you can see that now all the counties and cities are on board, and we try to have many more social marketing. So we invite all the mayors, okay, and governors to say their wishes, and we publish their wishes in the magazines, etc. Okay, and we have the assessment evaluation on each county or city's implementation. For example, we look at the establishment of multi-departmental committees. Actually, all of them have established that, and all of them were led by the mayors or magistrates. And they have. We also try to look at the frequency of the meetings, and we also look at how often the mayors or magistrates attended the active aging-related activities, etc. And also to look at the establishment of partnerships with academic institutions and NGOs. Okay. And we also compare the composite scores of individual counties and cities on their organizational implementation status. And we can identify that the pilot city still has the highest degree of implementation. And we also identify some remote counties. They have the poorest resources, and they also have the poorest implementation. So we can have more intervention upon these counties and cities. And we also look at the progress of our older persons' health status. This is the progress at the national level, but we also have data on local levels to see whether the disparities are closing or widening. Okay, and we also have many international collaboration and exchanges of experiences. I will not go into the details. So, in conclusions, public health sector must and can serve as the change agent to lead upwards and downwards, and to deliver strong voices. Facts shown as data or stories can be very powerful. And we need to have the confidence that things can be changed and we can serve as the leaders. And if well prepared and explicitly articulated, politicians would like to do something good for people. So actually we can be the leaders for the leaders. Politicians, they are willing to follow. Okay? And the shortest path, when you are doing the persuasion, communication, influencing process, the shortest path sometimes is not the direct path or the official path. Rather, quite often is the interpersonal, or sometimes you have to go upwards, then downwards to make things happen. Okay? And the leader has to lead not only the direction, but also the way, so that providing your followers with solid methodologies and good opportunities of success, that they can see they have high chance of success and they are willing to work together for the long time to sustain the relationship. And remember to create positive competition between followers. Competition and learning is more powerful than just oversight and accountability. So in addition to governance, you must have leadership. For the way forward, first, as I said in the opening, traditionally public health workers were more trained as a professional rather than a leader. So the future training should emphasize more on the leadership capacity to deliver effective political engagement, political dialogue, and intersectoral collaboration. Promotion, prevention, protection, participation. We hope that you also enjoy the participation of your people. And to conclude my speech, I would like to let you show a video from different ministers about active aging. Bye-bye. See you.
健康享受，享受健康。Good health add life to years。
乐龄无障碍，生活真自在。Great environment, great happiness。
交通无障碍，廉洁美好生活。Seamless transportation, connecting a better life。
乐龄学习，活耀人生。Senior learning, active living。
跨龄传承，友善职场。Decent age, decent work。
友善关怀咱是大，健康乐活糟透透。Live with care, no hearts everywhere。
友善高龄，长照关怀。Friendly aged society of high quality long-term care。
政策有爱，健康无碍。Love in all policies, health in everywhere.